Hi, in this case we are going to talk about nephrotic syndrome. Definition: is a non-specific kidney disorder characterized by a number of signs of disease, proteinuria, hypovolemia, and edema. It is characterized by an increase in permeability of the capillary walls of the glomerulus, leading to the presence of high levels of protein passing from the blood into the urine. Now we have a video about nephrotic syndrome.
Hello, welcome to Medistitute. In this video, we are going to talk about nephrotic syndrome. So, what is nephrotic syndrome? It is a clinical syndrome characterized by proteinuria, which means the presence of protein in urine in about more than 3 grams per day for a child with nephrotic syndrome. Hypoproteinemia or hypoalbuminemia, which means decreased level of albumin in serum blood. Usually serum albumin is less than 3 grams per deciliter. Hypercholesterolemia or hyperlipidemia, which means increased level of cholesterol in blood. Usually it is more than 250 milligrams per deciliter. Edema, which is accumulation of fluid in the interstitial tissues due to loss of protein in blood. We will explain that in the next few slides. And the last one is thrombophilia, which is increase in coagulability status due to decreased level of antithrombin protein, which lost by urine. Proteinuria could be happening due to glomerular causes, like when there is any disruption of the glomerular barrier of filtration of the protein, or by tubular causes when there is any increase of filtration or impaired reabsorption or secretion of proteins. Why edema can be happening? Let's imagine this is a blood vessel, and these are the cells, and here between the cells are the interstitial tissues. As you can see here, first of all we have proteinuria, which means loss of protein in urine, and this will lead to decreased level of albumin in the blood, which we call it hypoalbuminemia, and this will lead to disruption of oncotic pressure in the blood vessels, and this will lead to the shifting of fluid from the capillaries to the interstitial space. So why does the patient with nephrotic syndrome have increase in cholesterol level? When the patient has proteinuria, this will lead to decreased level of protein in serum blood, and the result we will have increased lipoprotein synthesis in liver and also decreased lipoprotein metabolism. This will lead to increased level of cholesterol and triglyceride in serum blood. Nephrotic syndrome can be happened due to primary causes or secondary causes.
Signs and symptoms. It is characterized by proteinuria, more than 3.5 grams per day, hypovolemia, hyperlipidemia, and edema, which is generalized and also known as anasazica or dropsy, that begins in the face. Lipiduria, lipids in urine, can also occur but is not essential. Hyponatremia also occurs with a low fractional sodium excretion. Now we have a video about steroid-resistant nephrotic syndrome.
Welcome back to MR6PSC. Today's topic is steroid-resistant nephrotic syndrome. Right now I'm discussing topics important related to the MR6PSC examination for part 1A and a B. Before starting this topic once again and again, I am requesting you to subscribe to my channel. Do let know your friends about my channel through Facebook, email or Twitter account. Before starting this, I would request, I want you, if you want any topics to be uploaded, please do let me know so that I can help you and your friends. The other thing, my aim is to give you more and more information in a less time. That's very important. Let me start with this. Let me give a kick start. Besides, get ready. What's the definition? The definition is a no remission after 4 weeks of prednisolone 60 mg per meter square per day. It's resistant, is not showing any improvement. No remission after 4 weeks of prednisolone of this basic protocol is called the steroid-resistant nephrotic syndrome. Right? Okay, let me start. Most frequently recommended treatment for SRNS is a CSA. What is CSA? Find out. Go to Google and just do it, because you will remember forever. Okay? that's nothing but a cyclosporine, right? It is no point. Okay, the other thing you can give is a prednisone along with this. The important, what you need to know for hemostatic examination is you need to know the definition of steroid resistance. That's very important. Okay, that's very important. Steroid resistance. There are different types like remission, relapse, and the frequent relapsing. That's what I will add. Those topics I will tell you later. Okay. So right now concentrate on this. This is very important. What is your aim in treating these patients? Is to reduce the proteinuria so that patient can no longer be nephrotic. That's very important. The other thing what you can give for the treatment is antihypertensive like ACE inhibitors and the ARB. That's very important. Okay. So histological findings, they can be similar to the FSGS, that is the focal segmental glomerulosclerosis. Okay guys, I'm done with this topic. This is a legit topic. I have not taken much time. Your time is very precious. Just go through this. And once again, I will take you to go to my channel. There is a playlist. You can click once and you can play. YouTube will play the videos automatically one by one, so that you will never miss a single unimportant topic too. Thank you so much for watching.
Phytophysiology. The glomeruli are affected by an inflammation or a annualization that allows proteins such as albumina, antithrombin, or the immunoglobulins to pass through the cell membrane and appear in urine. Albumin is the main protein in the blood that is able to maintain an oncotic pressure, which prevents the leakage of fluid into the extracellular medium and the subsequent formation of edemas. Now we're going to watch a video about nephrotic syndrome in children.
Have you heard of this condition called the Nephrotic Syndrome, which affects children and is supposed to be very dangerous? Can you tell us a little about this?
I would actually contest your saying that it is dangerous, because it's actually very scary for the parents rather than being dangerous. Nephrotic syndrome is a condition where you tend to leak a lot of protein in the urine. There is an inflammatory reaction in the kidneys, just like an allergy, and therefore you leak protein in the urine. Now, because you have leaked protein out, your blood protein level drops, and the water in the blood escapes out and collects in places wherever there is place. So, for example, under the eyes. So you start getting swelling all over the body. It's very scary for the parents to realize that the child is getting swollen. It's often missed because the child starts with a very minimal swelling under the eyes, and it's often presumed that the child has an allergy, but it's actually a leak of protein, and then gradually as the swelling increases, they see a doctor and this condition is diagnosed. Now,
Causes and classification. Nephrotic syndrome has many causes and may either be the result of a glomerular disease that can either be eliminated to the kidney called primary nephrotic syndrome, or a condition that affects the kidney and other parts of the body called secondary nephrotic syndrome. Primary glomerulonephritis. Like minimal change disease, the lesions are only visible using an electron microscope. Focal segmental glomerulosclerosis. It is characterized by the appearance of tissues carrying the glomeruli. Membranous glomerulonephritis, the inflammation of the glomerular membrane. Mesangial proliferative glomerulonephritis, inflammation with the deposit of antibodies in their membranes. Rapidly progressive glomerulonephritis, a patient's glomeruli are present in a crescent known shape. Secondary glomerulonephritis, like for example, diabetic nephropathy, systemic lupus erythematosus, sarcoidosis, syphilis, hepatitis B, Sjögren's syndrome, HIV, amyloidosis. And finally, we have a review of nephrotic syndrome. Nephrotic syndrome, also known as nephrosis, is an abnormal condition of the kidney characterized by marker proteins, proteinuria. Proteins go to the glomerular, cause inflammation in kidneys. Symptoms: protein urine, low blood protein levels, high cholesterol levels, high triglyceride levels, and swollen abdomen. Treatment: take corticosteroids, low salt diet to help swelling in hands and legs, water pills, diuretics, vitamin D, and blood thinners. Diagnostic procedures: 24-hour urine collection, blood test for albumin, blood profile test, and kidney ultrasound. Effects on activities of daily living: facial swelling, abdominal swelling, low salt diet, poor appetite, weight gain due to retention of liquid. Prognosis: various causes. Some patients have spontaneous recoveries and others worsen despite going to therapy. Interesting fact: nephrotic syndrome is called idiopathic because the disease is spontaneous without a known cause. And that's for all for this video. Thanks for watching.